Today we are highlighting something that impacts every workplace but doesn't always get the attention it deserves: preventative care. For employers, rising healthcare costs, absenteeism, and workforce productivity are constant concerns. For employees, access to preventative and early intervention services like annual checkups and screenings, immunizations, and mental health support can mean the difference between staying healthy and facing more serious health issues down the road. Kevin Ussery from Beebe Healthcare and Tom Belmont with the Greater Philadelphia Business Coalition on Health joined me to explore the value of proactive health management and how employers can better support their teams. They'll share insights on why prevention matters and how organizations can make preventative care more accessible and effective. Because preventative care isn't just a health benefit, it's a business strategy. Let's jump in. Welcome back to the Delaware Deep Dive, a podcast by the Delaware State Chamber of Commerce for our members, featuring our members. I'm your host, Kelly Basil, and today we're talking about something that impacts every workplace but doesn't always get the attention it deserves: preventative care. I'm joined by healthcare experts Tom Belmont, President and CEO of the Greater Philadelphia Business Coalition on Health, and Kevin Ussery, Executive Director of Total Rewards and HR Operations at Beebe Healthcare. Thank you both so much for joining me today.
Great to be here.
Yep, excited to be here.
Before we dive into the topic, I do want to give our listeners a chance to just kind of get to know the two of you, understand what you do at both your places of work. So Kevin, would you go first?
Yeah, absolutely. So like Kelly said, I'm at Beebe Healthcare down in Sussex County. My role really oversees our total rewards, benefits, compensation, day-to-day HR operations, employee health, and some well-being. So I'm really excited to dig into this topic and talk about how all those intersect.
And we were chatting right before we started hitting record, and you've been in Delaware for a few years now. You came to us from the Carolinas. Welcome to Delaware. How do you like it?
I love Delaware, especially down by the coast, the beach. It's probably one of the nicest beaches I've been to.
They are very underrated.
Yes.
Tom?
Tom Belmont. I am the President and CEO of the Greater Philadelphia Business Coalition on Health. I've been there about a year. Prior to that, I had a 40-year career in the insurance industry as a broker, so spent a lot of time with employers working on healthcare. And in our new role, live in Delaware or work in Delaware, New Jersey, and Pennsylvania, really focusing with employers and other stakeholders to figure out how do we make healthcare better.
Mm-hmm. To start us off, when we use the term preventative care, what does that mean, and why is it so important to a person's overall health? Tom, do you want to go first?
Sure. So preventive care is pretty much everything we don't want to do. Think mammograms, think colonoscopies, think all the things we avoid, and that's preventive care. Immunizations, vaccinations, and by doing that, by doing all those things, we really focus on how do we make our lives better. So you focus on quality of life, but it also decreases cost. Take the idea of a mammogram, that by doing a mammogram, I get a diagnosis or I get all clear. And from a quality of life perspective, by getting into that mammogram, having it done on a regular basis, having it done early, what we've seen in stats is you can actually take about $60,000 off of what the coverage is.
It's very appropriate that an ambulance is driving by right now. You're preventing going to the hospital.
That is preventive care. Thank you. So that's, I think from a preventive care perspective, quality of life, and the stats we've seen is you lower the cost of care if you catch things early. And you also just, in the case of cancer, you can extend your life 3 to 6 times what it would normally be if you get things early.
Kevin, do you have anything to kind of build off of that?
Yeah, it's really all about saving costs, but also improving the quality of life for you and your plan members, employees. To kind of echo Tom's example at the mammogram, I was at an employer. We brought a mobile mammogram unit on site, had a employee go to it, caught early breast cancer, saved her life because she had access to a mammogram and her regular appointment wasn't scheduled for another 6 months. She just happened to go because it was there.
Wow.
So it's those little things that you do that we don't think about, but getting a wellness check, getting biometrics done, getting your teeth cleaned, taking care of your mental health, all those things can prevent larger issues, but also just improve your day-to-day quality of life.
Mm-hmm. That we have a member, they won the coolest thing made in Delaware a couple years ago, the inaugural award, Hologic, and they make mammography machines. Also had an employee have access to that and caught early stage breast cancer. And she's this really just inspiring story of like what that means when you get checked regularly.
Yeah, it's probably, I would say it's probably the most important part of your healthcare is doing these preventative care visits and taking care of yourself.
Sorry, this is off topic. Well, no, it's on topic. I just didn't tell you both I would ask this question in advance. I feel like so many people don't have a primary care physician, though. Is there a stat around that? And why don't people have a primary care doctor?
So I think when you look at primary care and what's going on and just healthcare in general, and Kevin will talk about this and what they're doing at Beebe, but it's access to care. There's a shortage of doctors. We talk a lot about rural issues around healthcare and access, but in an urban situation, we're seeing the same things where we just don't have the number of physicians or the waits are so long. Like when you get into mammographies, for instance, or any kind of preventive care where you need follow-up from a test, sometimes that schedule is like 6 months out. So imagine you get, somebody says, hey, you need a test to figure out if that mammography was really something. If you wait 6 months, you're dealing with the mental health issues of that. You're waiting all the anxiety. And if it was something, then you're catching it that much later. So as we look at healthcare, and I think one of the things I was going to follow up with to the conversation you and Kevin are having about your member is we're seeing so much innovation right now going on with how do I build AI? How do I build technology into access to care so that whether it's through virtual care or an AI attendant, that we can make sure, A, you're getting your tests done, and B, that we're able to connect you with somebody. Maybe it's virtually we connect you with a follow-up visit, but we're connecting you with somebody so you can get the process going and be in the healthcare system. One of the things you see the most is that delay is usually where somebody who did the right thing, got the screening, and can't get an appointment for 6 months falls out. So now, you've lost that momentum that you had.
Yeah, no, that's a really good point. The entire reason I keep going back to my dentist is because they always give me my 6-month appointment while I'm there. And so you keep the person going back. And I can see how the drop-off is really easy.
Absolutely.
And access is a big issue. I'll just say in Sussex County, we're facing a shortage of providers just like everywhere else in the nation. But we're looking at some different ways to do things, more education and awareness. So a couple things we've started doing is we have a residency program for family medicine. We have 8 new residents coming on in July. So we're going to be doing some targeted outreach to our plan members to say, hey, we noticed you don't have a primary care visit. You haven't had a wellness visit. Well, here's 8 new doctors that you can get on a schedule with. We've hired some annual wellness visit nurses. While they can't prescribe and do full preventative care, they can do a wellness visit and get you started on that practice. We've also incentivized people to go to their PCPs and recently started a partnership with Ramp Health and looking to expand, which is a on-site coaching service for our employees, health coaching.
Okay.
And then connecting them with our care coordination team to plug them into different things. So let's say you go get biometrics, you've got diabetes. We have a really strong program using the National Diabetes Prevention Program that we can plug people into and start to get them the help they need quickly.
Okay, so moving on to my next question. From your perspectives, what are some of the biggest health risks or challenges facing today's workforce that preventative care can help address? Tom, I'm going to start with you again.
So the top 3 claims categories for most employers, not in any specific order, are cancer, cardiovascular, diabetes, and obesity. And those are all 3 categories where if there is preventive care done in advance, you can either A, catch things early, or B, avoid future issues with some of the cardiovascular diabetes. So those are the categories that are really driving costs within employers' plans. They're also the places that as you look at advances and the cost of care, like for cancer, if you get a cancer drug, it's a couple $100,000 a year. As you get into GLP-1s and some of the other advances, they become really expensive from an employer perspective. So that is definitely, those 3 categories are where we're seeing the biggest need. And, you flip it and it's usually probably in most employer plans, 5% of your cost is going towards prevention for those. and 95% is going towards the claim costs of those areas.
I'll let Kevin respond first before I go into my next
Yeah.
question.
And I'm going to take a little broader view here.
Okay.
A lot of those things can be caused and driven by stress.
Mm.
And so one thing when we think about preventive care we don't always talk about is mental health.
Mm-hmm.
And how are we caring for our employees to avoid chronic stress and burnout? How are we making sure they have access to mental health providers, that if they're going through crises, they're connecting with their EAPs, they're getting resources if they need financial help? Because we know when employees are facing less stress in their lives, they're less likely to have high blood pressure, stressy, do these things that may lead to more complicated problems,
Mm-hmm.
and maybe feel like they can go to a doctor. They can afford to take time off to go to a doctor. And those are the things I think that a lot of employers look at the specific disease states, but if we kind of try and address the root causes, that can help the downstream effects.
So, Kevin, your role is unique in that you work in healthcare,
Yes.
but you also manage this for your workforce.
Mhm.
So, can you talk about some of the examples that you're doing to address that?
Yeah, we actually hired a on-site mental health counselor about a year and a half ago who sits on our campus, people have free access to, and we have some interventions. So anytime there's someone's having an issue, someone's having maybe an absentee problem that doesn't quite rise to termination, or we notice patterns, we have a resource we can refer them to in person right away to kind of understand what's going on. Same thing with our health coaching. They're trained to identify some of these patterns and connect people back in.
Mm-hmm.
Mental health access is probably even more complicated than primary care access in the country and in the area, Sussex County especially. So we're constantly looking for different partnerships, ways we can support people to meet them where they are and get their needs met.
Did you see a huge uptick in your employees using these resources when you introduced it?
Absolutely. We have an EAP, but we still have a large portion of our population that just wants to talk to somebody in person.
Yeah.
They don't feel like picking up the phone. They don't feel like a Zoom call or an online chat is for them. So she's actually has a pretty steady case of regular employees, and she's also great for crisis situations when, in healthcare where there's a hard death, a hard patient death, or something complicated. And unfortunately, we've had being a small community, our patients are sometimes our coworkers or our family. And there's been some instances where there's been deaths related to that, where she's been able to do early interventions to kind of get people the support they need before they reach the crisis state.
That's huge. For smaller businesses, they don't have the resources to have someone on site like that. So, Tom, maybe this question is more for you, but what could an employer do when they are in a position to have someone on staff like that? Sorry, is that a tough question?
No, I think so. Both small and large employers are struggling with the same issues of trying to get access. I think, as Kevin said, they're in a unique position where they're able to have healthcare providers on site. One of the things I love about what Beebe's doing is they're taking the lessons learned both for their own employees and applying it out to the market as well. One of the things we tell employers is within your health plans or within some of your other programs you may be offering, like Kevin mentioned, the EAPs, make sure you're taking an inventory of what you have access to. In most cases, we find employers aren't utilizing their plans in the way they could and maximizing the benefits. And that's one of the areas that we have a number of employers who bring all of their vendors together. Now, these are going to be larger employers, but they bring their vendors together on a regular basis to make sure that they're working in tandem to improve the employee experience and make sure that they're getting to the right resources. So I would tell you that for small employers, large employers, make sure you've got access to individuals. And, I think the idea of on-site is great, but for some of those smaller employers, they may not have that access. So even just making sure you've got access to virtual providers, it is, just one of those areas that if you can do that at least, that provides a different level of support. And I think the other thing Kevin talked about, and you think about some of the stressors for employers, and this is small, large, and Kevin talked about this when we were together a short time ago, is really financial stress. And employers can do a lot around that because that drives a lot of the mental health concerns that people have as well. And I don't know if you want to talk a little bit about that, Kevin.
Yeah, I'll talk about financial, but I want to build on something you said about access. Most employers have some kind of hospital or healthcare system in their community.
Mm-hmm.
And in my experience, a lot of them are willing to partner with the employers and create some kind of arrangement where they have access to providers at a reasonable cost.
Mm-hmm.
So that's something they can do. When it comes to financial wellness, that is a big cause of a lot of things, and we've taken some inventory and made some changes. Our minimum wage is $16.50 an hour, so much above the state minimum wage, and we look at that constantly to make sure that it is reasonable. We don't have people living below the poverty line if we can avoid it, and also looking at how do we help teach them how to better understand their situation and manage their funds.
Mm-hmm.
So we partner with our retirement vendor, Lincoln Financial, offer some classes. We're actually expanding that this year. We've created an emergency care fund for those situations where, a tree fell on my house, or, my kid got really sick and I can't pay my bills now. So that's one of the things we've added, that we understand those situations happen. So employees can apply for that anonymously and get some immediate cash to help get them through the crisis they're in, so that they can focus on getting back to being well.
Mm-hmm. That's great. Tom, I want to go back to something that you said earlier about employers paying for essentially 5% of preventative care. That's kind of a shocking percentage, since preventative care is so important, but then it's getting kind of the least amount of resources and attention. You also said, both of you, that it lowers costs for employers. So why isn't there a greater emphasis on paying for preventative care?
I think that 5 to 95% kind of ratio really has to do with the fact that preventive care is less costly than advanced care for conditions. So, if we could at least flip the script a little bit, the more we flip the script, the more we can drive down that 95%.
Mm-hmm.
So, I think we'll talk about strategies that employers utilize. I would also say to you that as we talk to our members, a lot of what we're suggesting to our members and a lot of what our members are doing, like Kevin's talked about as well, is looking at the data and understanding, what are the gaps in care that we have? What should we attack? We had one of our members had a low number of their employees who were getting HPV vaccines. And they manufacture that vaccine. And they brought in a similar company to what Kevin was talking about with RAMP to help coach their employees. They set a goal, they set an objective, they measured the strategy, and they went from 15% compliance based on the age and demographics to 85%.
Oh, that's a big jump.
It's huge, and I think they set it as a goal. They brought in the right resources, and same as Kevin talked about with what he's doing with RAMP is, sometimes it takes a partner to sit at the table and encourage your employees, be that face-to-face, one-on-one to get them to the next step. That I think is what employers need to do in terms of a preventive strategy. The focus for employers and the problem for employers is they're getting hit with such significant increases that there's a lot on their plates.
Yeah.
So just taking preventive and making it a priority while you're dealing with everything else that you're dealing with is sort of the struggle for a lot of employers.
And I think to echo what Tom said about data, that's very important, because there's a lot of preventative care can be very broad,
Mm-hmm.
but not every employer population is the same. So understanding the unique needs of your population really can help you identify, what do we need to cover more of? What do we need to offer? We just brought out biometric screenings this year for the first time in probably 5 or 6 years. And that's going to give us an opportunity to look at the aggregate data of our population, of our team members, to say, all right, what are our top concerns? We have the claims data, but this will give us another look to say, what are trending concerns? Do we have a lot of people that maybe don't have high blood pressure yet, but are on the cusp? Or have a lot of people that have pre-diabetes? So we can start to look at attacking those things before they evolve into the more costly claims. And being a healthcare system, we do have a unique opportunity because we have a population health team. We have a care coordination team that we can partner with to look at the data and really say what programs can we offer in-house and what programs do we need to look at partners for, because you can't be everything to everyone, and we are great at a lot of things, but we're also a small coastal hospital system. We don't offer every service. So identifying that really can help people determine, where do you spend those dollars, those limited dollars you have.
Kelly, I think it's great that you have an ambulance going around the
I
corner
know.
just to make the emphasis on this.
I
on the
planned
care.
that. Well, it's a good thing Christiana Care is just down the road.
I will tell you, I think one of the things to your question about, from an employer perspective, and Kevin mentioned the National Diabetes Prevention Program, they partner with the Y, and as a administrator for the program, NDPP what is interesting and what employers, we try and highlight for employers is there are a lot of community resources that you can leverage without any additional cost to you as an employer. And they want to get involved, whether it's the American Heart Association, Cancer Society, ADA. I know Procter & Gamble Dover Wipes really partnered with the Y to bring in a cardiac program, bring in a diabetes program that got great participation from their employees, and it got their employees a 4-month free membership from the Y. So it was just it's just a great combination of, how do you leverage some of your partners in the community, and especially community providers like Beebe and others that want to help where they can.
Yeah, I think so much of it too is just education, because employees don't know what they're looking for or where to seek something. And so if you as an employer can just kind of lay it out in front of them and be like, here's your menu of options, they're so much more likely to take advantage.
It's interesting. We have an employer, and to your point about that usually from an employee perspective, you don't pay attention to anything until it impacts you.
Right.
So we do have an employer that's working with the National Comprehensive Cancer Network, and they do monthly briefings on oncology topics. It's had a big impact on their membership because it puts it top of mind for folks that when they get that diagnosis, God forbid or whatever, that they have an opportunity and they know where to go. And so to your point, from an employer perspective, it is consistently talking to people so that they know, hey, when I get something, where do I go? And it is really going to be when it matters to you that you pay attention.
It's also looking at how you communicate and meeting your employees where they are. So a large portion of our workforce is deskless. They're not on their computers. They check their email they have a limited time to check their email. They're charting, or their EVS team members in and out of rooms cleaning beds. So coming up with creative strategies on how you reach people that maybe they won't see a flyer in a break room, or they don't check their email.
Right.
Do things like, if you have huddles, have manager talking points at huddles, explore text messaging, apps, just anything you do to get it in front of them. And then when you think you've communicated enough, communicate 5 more times.
Everyone here at the chamber hears me say that all the time. You have to communicate the exact same thing in 12 different ways, and one of them will stick with one person and the other will stick with another person. So before we wrap this up, I'd love for both of you to each just give what your recommendation would be for an employer who can take just one practical step in the next year to strengthening preventative care for their workforce.
So mine will be, and sorry, I'm never short with my answers, but it will be, get your own data, look at one thing that you can do this year, set a priority for it, set a goal, put in a strategy for it, educate on it, and to your point, communicate, and then measure it and make sure you're measuring towards that goal. If you can get one thing going, you're going to be able to get more going because now you've got a roadmap for how you continue to improve.
I would say incentivize your employees and remove barriers to access. So we have a wellness program, and part of that to get $600 off your insurance premium for the year, part of that's going to get a wellness screening, doing biometrics, doing a health risk assessment. And this is kind of fresh off the press, but we are looking at lowering our copays for primary care visits for Beebe providers for our members to no cost in the upcoming plan year. So these little things that you can do really do add up to show the employees not only we support this, we want you to do this, but it's so important. We're going to give you incentive to go do it.
Yeah, no, that's great. All right.
Can I echo off of that for 1 second?
Yeah, of course.
I think, you asked a question a while ago, and, what Kevin just talked about, it is about also being an employer of choice. So by bringing those, they're in such a competitive industry at Beebe. So by bringing those co-pays down, you're showing your employees that you care about them, and any campaigns that you do show your employees you care about them. It does increase your ability to retain those employees. The other one thing I just wanted to say is with prevention, we've talked a lot about the healthcare side, but when you look at, we spoke to somebody from U.S. Steel, and they started a whole GLP-1 view when they saw some workplace injuries. They had a number of people. The leader up there talked about the fact that they have ladders in the factory that have a weight limit of 250 pounds. They had 300-pound people crawling up those ladders. You're going to get hit by a big truck. You're going to fall off the ladder. So, building strategies that around prevention also help you on the other side in terms of workers' comp and workers' injuries. So, absenteeism, presenteeism, all of those things are impacted by a good prevention strategy.
Yeah, no, that's great. Sorry, I meant to mention this and kind of give a real example here at the chamber, what we offer our employees to your point, Kevin, about just like small little things that kind of build up and help. We're a nonprofit. We're 11 people. We do not have an on-site mental health professional, and we probably won't ever. But we do little things as much as we can to help our employees with access. But one of the little things that I've always really loved that we offer is an annual wellness allowance. And that the definition of that is pretty broad. You can buy a good pair of sneakers. It's your gym membership, an Apple Watch. I use it for my synchronized ice skating team dues. It all kind of goes into making sure that we're healthy and active. And it's just like a nice thing that we can offer our employees.
There was an article recently about, I think it was Deloitte, offers a lifestyle spending account as well. And they actually had employees buying Legos, which was from a mental health perspective.
Oh, there you go.
They use the Legos. So you see that is a trend. You do see lifestyle spending accounts growing, which are after-tax accounts that allow you to pay for different wellness services, similar to what you're doing. I think the other piece that we're seeing people do is just, the on-site care, and the closer you can get care to the person, similar to what Kevin was talking about, it is important and really drives that result.
Yeah.
And we know healthcare is unique, but employees are unique too. So what works for Beebe, what maybe works for the chamber may not work for every employer. So you really need to understand your population and their needs and build those programs to meet them where they are. Because the easier it is for them to do something, the more likely they are to do it.
Sorry, I'm writing down an episode title because you just sparked my interest.
Oh, glad to help.
Before I let you both go, how can someone get a hold of you if they, heard a snippet of information from today's episode and want to chat?
So our website is gpbch.org, which I think I got that right, or tbelmont@gpbch.org.
I always have to say your organization's name out so I can get those initials.
You can't do it in an elevator, that's for sure. It's not.
And our website is Beebe Healthcare, and that's beebehealthcare.org. That's the best place to look at the resources we offer from a patient and community perspective. But people can reach out to me at KUSSERY@beebehealthcare.org if they have questions for me about the programs we offer.
Thank you. And if any of our listeners have questions, suggestions for future episode topics, or just want to get in touch with me or my colleagues at the Delaware State Chamber, our contact information can be found on our website, dscc.com. You'll also find the State Chamber on social media, Facebook, X, LinkedIn, YouTube, and Instagram. And with that, thank you both so much for joining me. I really enjoyed it.
Thank you.
Thank you.
Thanks for joining us for another episode of the Delaware Deep Dive, brought to you by the Delaware State Chamber of Commerce. Before we sign off, please take a moment to subscribe, rate, and review wherever you listen. I know podcast hosts say this all the time, but your support is invaluable, and it helps other listeners easily find us. I'm your host, Kelly Basil. We'll see you soon.